All right, I just clicked start streaming, so we are now live.
Okay, hi everybody. Thank you so much for joining. Today we have Dr. Natalie Salman, and she's going to be speaking to us about general dentistry.
Hi, everyone. Thank you all for having me. I want to thank the dental shadowers, especially for including me and reaching out to me to speak to all the pre-dental students or dental students, whoever's out there. So again, I'm really appreciative for this opportunity, and hopefully you guys find what I'm about to share with you beneficial. And we will be answering questions at the end, so make sure you guys write them down if you do have any questions that come up as we're going through the lecture. So I'm just going to go ahead and get started. All right. So who am I? I'd like to introduce myself first. You guys all know my name at this point. It's Natalie Salman. That is me when I'm wearing a white coat, which is not frequent. I tend to stick to scrubs. I'm a general dentist in Palos Heights, Illinois. I pretty much grew up here almost my whole life. I'm Jordanian and Lebanese. I speak two languages. I grew up in two countries, mostly in America. I'm a practice owner, and this is my practice, All Heart Dental. I've been there for a couple years now, and I'm really proud to say I accomplished that. Besides that, I'm a wife. That's my husband. I'm a dog mom and almost a human mom. We're expecting a baby next month. And I love to travel. That's me in Thailand. That's me in Iceland, two very different climates. And I'm a huge soccer fan. So you're probably like, okay, why is this relevant? So I really genuinely feel like it's so important in fields that consume us and requires so much studying and such a long path to finally reaching our careers, to really just remember who we are as people outside of the profession. So, I personally don't like to just be identified as a dentist, and let people know me and know the more relatable side to me, because not everyone's going to be able to relate to me being a dentist unless you're a dentist or interested in dentistry or you just really like teeth. But I think it's really important to always just remember who you are, allow it to be a part of you that makes you personable to others, and just keep that in the forefront of your mind, because you are more than your career, despite how important it is and how hard we work for it. Maintain that balance. So I know you guys are like, okay, that's great, but where'd you go to school? We want the nitty gritty details, and where are you now in life? So I went to Sandbox Preschool. Okay, I'm kidding. I graduated from Loyola University, Chicago in 2010. I majored in biology, and I had a minor in English with an emphasis on creative writing. That's something that I really picked up very last minute, because I had the flexibility during my undergrad years. I love literature and I love creative writing. So when I knew that I was kind of edging towards finishing my bio major, I decided to minor in English. After college, I ended up going to Midwestern University College of Dental Medicine, and there was no major there. It was just survival of dental school. I graduated in 2015, and if you know anything about the school, 2015 was the first graduating class. So with that said, we were the class that went through the process of accreditation of a university, and that's not something you think of or you ever expect to experience in your life, but there we were. So it was cool to see the background and how much goes into getting a school accredited, where it's qualified as a dental school that is graduating professionals that are competent and know what they are doing. There was obviously, with it being new and they were kind of sorting out the details, there was a lot of hiccups in the road, or like I would say knots that needed to be needed. But our faculty was pretty awesome. It was kind of a double-edged sword. In some degree, it worked in our favor because as the first class, we had no D2s, no D3s, no D4s. It was just us. And we got so much attention from our faculty that they knew almost every single one of us by our first name. And with that said, the school gave us the respect to kind of check in, see how we felt, how the program was going, if we felt like something was working and wasn't. And they really, really did everything they could to make sure that we felt that we were moving the right direction and we were prepared. So I genuinely loved my time there. I love Midwestern, and anyone I know who wants to apply there, I'm like, do it. It's the best school ever. And I know other people are like, no, you're biased, but no. So after dental school, I became an associate dentist for 3 years. So what that means is, if you don't know, I worked as a dentist for another dentist. And in those 3 years, I worked actually, instead of just focusing on one practice, I ended up working in 2 different ones and kind of made a full-time schedule out of the both of them. They were really different. One was a huge team that required it to be a very, very well-oiled machine. And the other one was a little bit less volume, but because of that, it allowed me the flexibility to really focus on my clinical skills, kind of build them up after school, because although dental school, you're learning a lot, you're taking boards, and you're in the clinic and you're treating patients, there's a difference between when you're prepping, which means drilling a cavity out for the first time, and you're not being supervised by a faculty member. There is no checks at that point. It's, you've got to know what you're doing. So it was nice seeing the dynamic of both of those practices. I thought it was really important because one allowed me to see how things work at a faster pace, at a more efficient pace. And then the other one really just allowed me to focus on procedures, really rely on a small team and how that contrasts with a big team. Both experiences were great. The doctors I worked for were incredible mentors. And shortly after that, I ended up buying my own dental practice. That was my goal when I reached my 30th birthday, that I would be already have signed my contract and owned a practice. So my practice is called All Heart Dental, and I've owned it since 2018. And in between all that, I actually joined the adjunct faculty. I went back to Midwestern to teach part-time for about a year, and I loved it. I would probably still be there, but with the pandemic and everything, I had to kind of shift gear, focus a little bit more on my practice, and I also found out I was pregnant. So that's kind of a nutshell of what got me to where I am today. So I'm a general dentist, as you guys all know now. And what is general dentistry? I'm sure you have some idea. The actual definition is that it is the evaluation, diagnosis, prevention, and or treatment of diseases, disorders, and or conditions of the oral cavity, maxillofacial area, and their impact on the human body. That's a mouthful. So what I love about this really broad definition of general dentistry is it's broad. I mean, you have to know kind of everything, because anything can walk into your office at any given point. It could be a virus in the mouth. It could be a cavity. It could be a broken tooth. A person could have muscle disorders with their TMJ. They might have oral cancer. They could have gingivitis, which is inflammation of the gums, or periodontitis, which is identified as bone disease, bone loss in the mouth. So with that said, that's what I really love about general dentistry, is that it's not just one thing. It really encompasses a lot, and it keeps you on your toes. I'm someone who tends to get bored very easily. So this is a field that I have never found that, because I just don't know what's coming in the door on a day-to-day basis. And yes, there's the common procedures, but just in general, everyone is so different. Every mouth is different. Every tooth is different. So it's nice that there really isn't no autopilot. It's almost like you're constantly being challenged. even in a repetitive way, if that makes any sense. So yeah, that's general dentistry. And how did I choose this career? So I, like many of you, was once an undergrad. And at first, I was really considering medicine. That's why I chose biology as my major. I knew I wanted to be in the health field in some regard. I don't know if I was necessarily sure which route I wanted to take. At some point, I started studying for my MCAT. And then I decided, oh, I like law and I'm going to start studying for my LSAT. So I actually started studying for my LSAT. Then I was like, oh, I really like teaching and literature. Maybe I should go into education. And then my dad had mentioned to me once, he's like, you should look into dentistry. You'd be really good at it. And, it's a good lifestyle. It's a good career. There's so much to it. And you like science. So at the time, I kind of was like, no, teeth, but joke's on me. I liked fine art, and I don't mean in like painting or sculpting. Not that there's anything wrong with that. I'm just not a sculptor or a painter, but just I liked the creativity side of life. So I was like, what can I do with that? And then I repeated going through like this cycle of medicine, law, education, dentistry. What do I do? So you guys know I slowly crossed off everything except dentistry. So what I realized very quickly is dentistry really did involve everything I loved. It is medicine. There is law to it, legality. There's education, not just for myself, which as any kind of provider, we're constantly learning, but we're also educating our patients. We're educating each other, our staff, our teams. It involves fine art. You'll learn, you shouldn't, but you will quickly learn that you have to pay attention to fine detail. So there is a fine art to it. And as a practice owner, there's the whole business side of it. You're working with people, you're working with different companies, different groups. There's the psychology of just learning how to read a room, how to read your patients, understanding things. Listening is really important. It also involves having vision, not just if you plan to be a practice owner, but also vision in what do you envision yourself as a dentist or as a doctor. Where do you want to see yourself in 1 year, 3 years, 5 years, 10 years? And that also comes hand in hand with design and creativity. Just kind of really building who you want to be and being able to reflect that in how you practice. So that is why I love dentistry. It's a lot moving at once, but it has all the things that I genuinely am passionate about. So although it worked a little backwards for me because I applied to dental school not necessarily knowing, do I love dentistry? And I got in and I was excited, but it wasn't like that excitement that I probably should have felt at the time. And I remember sitting in orientation and we were like opening up our simulation lab lockers and people were pulling out instruments and every person next to me was just like, oh my God, this is the greatest thing. I can't believe I'm here. I've wanted this my whole life. And I'm just like, I felt like such a phony because I really wasn't sure if this was something that I genuinely wanted. But I was like, if I don't like it, I can always, I have a laundry list of other things I could choose from. So I learned very quickly that although it worked backwards for me, I really could not imagine myself doing anything else but dentistry. I absolutely love my career. I'm very passionate about my career. And I'm just grateful that I gave myself the opportunity to learn that. And I didn't just, well, I did roll my eyes at it once, but I didn't actually commit to the eye roll. So that's how I chose dentistry. So if you're kind of on the fence, just know there's a lot that goes into it. It's a great career. There's so much there. And this is just in one aspect. There's still specialties and other fields that you can get into. So, all right. So I don't know, am I blocking my PowerPoint a little bit?
No, it looks good.
Okay. All right. So college is a lot, and you guys are all going through that right now. So the main question probably is, what do I focus on? I'm sure you all know how crucial your GPA is at this point. It allows you to be competitive. So I'm going to say it, it's obvious, but GPA. It is so important. But with that in mind, you always want to pick a schedule that is a little meaty, but not too much to bite. So you never want to just go full blown out where you cannot handle it and that negatively affects you. But you also want to be able to show, hey, I did have a healthy schedule. It was a lot, but not overwhelming where it kind of lowered your GPA. But with that said, your DAT score is crucial. You'll typically take your DAT your junior year, your senior year, depending on when you're planning to apply to dental school and how quickly you want to get in. But the DAT score is really important because it's a kind of a standardized way for dental schools and dental programs to evaluate their candidates on a level playing field where they all took the same test, and these are their scores. Why that's different than your GPA is universities are different. Like there's not that one's necessarily superior or inferior to another, but some might be more competitive or have a stronger area of study, or you could have majored in something completely different, but did your science prerequisites. So your GPA, while it's important, this is the reason your DAT is important. It's just a standardized test, kind of. I also wanted to mention with your GPA, if you aren't planning on majoring in any of the sciences like biology or chemistry, it's probably good to early on look at some dental programs to see what prerequisites they do need so that you make sure you're accomplishing them as you move forward. And it's not junior or senior year and you're just like, oh man, I have 45 credit hours that I need to fulfill or whatever it is. Why are extracurriculars important? They show a different side to you. They show that you could balance academia and being involved in your community, being involved in other students, other causes, and just dedicating your time to different things. It's one thing to just keep your head in the books, which despite how little time I feel I was not studying, I was still managing to do some extracurriculars while I was in college, but even when I was there, I was like, oh, I should be studying. So I get that pressure, but just try to maintain a kind of a balance between the school and the extracurriculars. Another thing that I would tell you to focus on is your mental health. Again, it is so easy to get consumed in our careers in school, and I've been there. I value and respect your dedication to your career and where you want to go, and knowing so early on that this is what you're passionate about. But it is a long road of schooling. So keep that in mind and do the things you love. Make time for yourself, whether it's working out, playing music, an instrument, listening to music, arts, going on walks, spending time with your family. I know that's something that I never could remove as a factor because they've managed to always keep me sane. But just, take care of you, because if you get burnt out, you have to remember sometimes these things don't stop or you get bogged down by it. So just kind of keeping in check, making sure you're healthy is super important. And last but not least, enjoying college. Again, I know it's like, no, we got to study and we got to get these grades, but you are in college probably once, maybe twice in your life. And it's so important to enjoy the time you're there and really experience it, because you'll look back at it and it does fly. I know you don't feel like it when you're in the grit of it, but it does fly by. And just remember that at the end of the day, it is all about balance. So we're done with school now. I have my own practice. What is it like to have a day in my shoes? Well, most days it kind of feels like this, where I'm putting out a fire or something crazy is going on. But I'm kidding for the most part. Besides that, what it takes is a day in my shoes involves my team. Teamwork. I could be the best dentist, but I would not be successful without my team, and I have to give them a shout out. Without them, I can't imagine that our days would move as fluidly as they do. They show up every single day, and they give the best of themselves to their patients, to the practice, to me, and they're constantly challenging themselves. And I always applaud them before I would ever applaud myself. I wouldn't be able to do it without them. So with that said, another thing that's super important and consumes a big part of my day is obviously my patients. Again, I could be the best dentist in the whole entire world, but I would not be successful without my patients, without them showing up and being there. And it's really important to keep that at the forefront of your mind, because knowing that your patients are showing up is really humbling, and it's a reminder that this is a privilege. Although you work so hard for it and you earn the degree and the clinical skills and the experience, without them, you would have nothing to do with all that experience and all that knowledge. So I always am humbled by my patients. I'm humbled by the trust that they give me. And I know that I would not be successful without them. Another thing that consumes my day is business management. When I was an associate, this was a little bit less on the priority list because I just kind of showed up as an associate dentist, did the work, and went home. But now as a practice owner, it involves accounting, finances, payroll, overhead, just everything in general, that the ins and outs of a business and what you need to get them to work and work successfully. Problem solving, whether it's equipment, patient problems, patient concerns, complaints, anything that might go wrong. If staff has to call out, how is this going to affect us? How do we get through the day? So although we reach a point where things are very consistent and it does become that well-oiled machine, there's always those little monkey wrenches that get tossed in our day. So in the beginning, when I first owned my office, and when I first became a dentist in general, which my first day was a total nightmare when I bought my practice. I walked in and I had bought the practice, and it was supposed to be I come in once the other dentist leaves, and the whole staff was supposed to be there. I had met them once, and then I showed up on Monday morning. I was so nervous because I just bought a whole entire business, and now I have to treat people that I've never met. And before the staff got the opportunity to work with me, I arrive and someone comes up to me and they're like, "Oh, everyone quit except like me and one other person." And I'm just like, "Okay, great. It's okay. We'll be all right." And the day domino affected into just like this flame that I felt like I was encircled with. And I went into my office and I cried, and I closed the door so no one would see me crying. But I quickly learned that there's always going to be something that comes up. It taught me very quickly just to take it with a grain of salt, kind of learn to brush it off your shoulders. The same way that when I was a student and like things didn't go my way, or there was a conflict in my classes, or my exam score wasn't where I wanted, you just kind of learn to let it affect you less, and how do you move forward from there. So that's just something that I will have to face for the rest of my career, or as long as I own a practice. And then another thing is growth, consistency, innovation, working out of your comfort zone, marketing, and just really establishing your practice, your name, your feel as a dentist, and constantly moving that forward so that you don't plateau, because you always want to know that you're growing in some regard. And I don't mean just successfully or financially. I mean even just challenging yourself as a person, as a provider, as a leader, as a teammate, all of the above. So and then, a big part of it is staying positive. It's not always easy. Some days are way more challenging than others, but it's 100% worth it. Being able to be a doctor and provide care for people is something that is really rare. Not everyone could do it, and it's an honor. It's a privilege. So with that said, besides putting out flames, the dental office, what happens there? What does our day-to-day look like? So in my practice, which I'm going to speak for, this is kind of how our day starts. We set up, we have a morning team huddle. That team huddle involves going over all our cases for the day, seeing who needs radiographs, what is someone coming in for, are they insurance patients? Do we need to go over finances with them? Kind of reviewing their medical history, making sure that we're not giving them anything that we should not be, kind of making ourselves aware of what emergencies might happen in the chair. Although we don't want them to happen, they could happen at any point. So whether a person's diabetic or they have high blood pressure or they're asthmatic, you just always kind of want to be ready for anything that could happen. And after that, we are greeting our patients. So we wrap up with our team huddle, greeting our patients, seating everybody, and then patient care starts. Patient care is simultaneously dental and hygiene appointments moving at the same time. While that is going on, we are diagnosing, we are explaining treatment, we're updating patient charts, we're communicating with different specialists, different physicians, with labs for cases we're doing. We're talking to pharmacies, we're talking to vendors, we're sterilizing instruments, and then between every single patient, we're setting up and breaking down the operatories, we're restocking supplies, and then while we're doing all that on the back end, our front desk is answering calls, emails, verifying information and insurances. They're collecting payments, presenting treatment, presenting finances, checking people in, checking people out. So there's a lot of moving parts all at once. And then at the end of the day, we're sanitizing and sterilizing, and we're breaking down. So again, it's a lot going on, and this is why it's so crucial to have a great team. So procedures you'll commonly see when you go into a dental office, a general dental practice. Majority are fillings, whether they're composite or amalgam, which white or silver, crowns, bridges, dentures, implants, cleanings, which are identified, the dental term is prophies, deep cleanings, which the dental term is scaling and root planing, extractions, root canals. A lot of people come in for emergencies, whether they have a swelling, an abscess, or pain. Some people will come in just for cosmetics, bleaching, or Invisalign. And Invisalign is not to be confused as only cosmetic. It is also corrects things other than just cosmetology of your mouth. Other ortho procedures, they'll come in for night guards, sports guards, whether they're athletes or they're just clenching or grinding at night. So these are the most common things I see. And like I said, I know this is a lot, but this is why I love general dentistry. There's just so much involved. So patients, what do they want? A lot of people will come in for a toothache. Sometimes that's addressed with a restoration, an extraction, a root canal. A lot of people will just say, I need a cleaning, and they could have gum disease, gingivitis, or bone disease, periodontitis. A lot of people come in for cosmetics, straighter teeth, whiter teeth, gummy smiles, chipped teeth. And then some other people will have missing teeth, whether they never had the tooth or the tooth broke or they had it pulled. And that gets addressed with dentures, bridges, implants. There's a lot of options. So we know what they want, but what do patients really need? First and foremost, they need you to address their concerns. If a person is pointing at their front tooth and you're like, oh, but we're going to work on the back one. You didn't really address their concern. They need someone to educate them on their conditions. This is what you went to school for and why you went to school, to educate your patients so that they understand their health and allow you the opportunity to treat their health. And they need you to treat them well. I always say, treat them like they're your family, do justice by their side. And keep in mind that everyone's priorities are different. So how do we get the job done? Dentistry is a field that is ever evolving. It's constantly advancing its tools and technology. There is so much out there. I mean, at some point, I wouldn't be surprised if robotics are able to do dentistry for us. And while those things are great, they've made our lives so much easier compared to, things I hear dentists did like 60 years ago. I'm like, okay. You always should start with the basics, which is one, your knowledge. What you went to school for is really important. By going to school, you gain the clinical and the medical knowledge to how to be a dentist, how to treat people, how to understand the person's body. You always want to listen. There's value in listening to your patients and hearing them out and hearing their concerns. And then using the basic tools to diagnose, which the most common ones are your mirror and your scaler. Your scaler, not your scaler. I'm blanking right now, your explorer. And your radiographs. So those are the two, what I would say most common things I use as a general dentist in order to diagnose. So although technology is great treatment can only be done after a proper diagnosis. And you always want to keep that in mind. In order to do that, you got to rely on what you learned, what's in front of you, and how to read it and understand it, and also to listen to your patients. So with that said, I'm going to go through a couple cases with you guys. Claudia, is the full PowerPoint screen visible?
Yeah, it is.
Okay. All right. So first case I'm going to go through is a 59-year-old patient presents to the practice with a chief complaint of these caps were placed on my front teeth after an injury when I was younger, and they've just always looked like this. They don't match my teeth. I am not happy with them. Do I have options? So this is the person's front teeth, the ones that they are referring to that they don't like, that were capped, which it means crowned at a younger age. So what you want to do is always go through their medical history. In this case, he was a healthy patient. His only concern was an allergy to penicillin, which didn't matter because we were not prescribing anything. His periodontal health, which is this chart down here with all the numbers. He has localized gingivitis, which is inflammation of the gums. It's mostly in his posterior teeth. So although we are working with our patient to always better that and control that, where we want to restore the teeth, his gums are healthy. Looking at his hard tissue, which is his teeth, tooth number 8 is vital, meaning it has a nerve. Tooth number 9 is non-vital. It has a root canal in it, which is the white line going through the tooth. So we know that both teeth have crowns on them. One has a nerve, one does not. And the diagnosis that I went with is malocclusion, which means that his bite is not right, crowding on anterior teeth, and he has cosmetic concerns. So how do we proceed? So things to consider before we ever decide on treatment is periodontal health. Is there enough bone there? Is the gingiva, the gum tissue healthy? Which I kind of went over. Another thing you want to look at is vitality. Is the pulp, the nerve, healthy? If there are root canals that have been done, do they need to be retreated? Meaning, are they failing? Because that can happen. In his case, we got that evaluated and he looked okay. Tooth structure, once these restorations are removed, what's underneath? There's only so much we could see on an x-ray, and surprises in dentistry are not necessarily always pleasant. So you want to ask yourself, do we have enough tooth structure to work with? You're looking at the occlusion, which is the bite. Will there be any interferences? So when the patient bites on his teeth, do we have enough room to put anything there, or is he going to feel like he's constantly hitting on his front teeth? Cosmetics, can we achieve realistic goals that the patient will be happy with? And that's really important. Although you can't guarantee things all the time, you want to make sure that you and your patient are on the same page with the goal that they're setting, and if it's realistic for them. So I obviously proceeded with this procedure. The treatment was to replace his existing crowns, tooth number 8 and 9, which are your central incisors, with Emax crowns. What are Emax crowns? They're just a higher degree of cosmetics when it comes to porcelain and ceramics. They have a really nice translucency to them. They look more natural than kind of these white crowns that he has right now that are just really dull. They're one color, they're flush, they have no characteristics to them. So this is what we ended up with. And excuse me. This was a case, honest to God, this is one of my favorite cases that I've ever done. I love the cosmetic cases that come through, but I love the ones that aren't necessarily just, I want the whitest teeth possible. I want them to look perfectly straight. This was one that just in changing the 2 central teeth in the front, his teeth look absolutely beautiful. And initially he was really worried. He's like, I feel like my teeth are so dark, but they weren't. You can tell the difference between both pictures as to why the other teeth looked so dark. It was because he had 2 white ones that just completely stood out like sore thumbs. And when we were able to get a better fit with his new crowns, ones that matched his bite, made his teeth look way more aligned. They look natural in the sense that they match the rest of his teeth. And he actually has a beautiful smile. So this is a case that I genuinely like because it wasn't necessarily just, hey, how do I get my teeth to be as bright as possible? So it presented its own challenges, but I was extremely happy with the result, as was the patient. So the second case is one that I'm going to get into that's really, really different. It's a 59-year-old patient who presents to the practice. His medical history is reviewed. There was no concerns. Dental history tells us that the patient has not been to a dentist in over 7 years. After his clinical exam is completed, scaling and root planing is recommended due to bone loss and significant probing depths of the gingiva, which you can see with all the numbers. 1 to 3 is healthy. Anything above a 3 starts borderline unhealthy, and he has anywhere between 4 to, I believe, 6, and it's kind of all over his mouth. So it's generalized. We also recommended replacing an amalgam restoration on tooth number 30, which is the bottom right molar. Patient agrees to treatment, but before anesthetizing, the blood pressure is taken and it's measured at 190/112. The patient states that he has not been to a doctor in over 10 years. So if you know anything about blood pressure, anything higher than 180 or systolic and 110 diastolic is an emergency, and that patient should be directed to the hospital. And in his case, he hit both of those. So now what? When we reviewed his medical history, there was no concerns. But it turns out he didn't even know his own medical history. He hadn't been to a doctor in so long. So again, I particularly picked this case because it goes hand in hand with what you need to know as a clinician, and not just as someone who's just doing dental work, but you need to understand the body and how it comes into play with what we are doing in the dental office. So what did we do? We urged him to go to the ER regarding his blood pressure, explaining that his heart is working way too hard. Non-urgent treatment was put on hold until the patient did see his physician. He had to get clearance from a primary physician to continue dental treatment. He ended up returning 6 months later, having lost 60 pounds. He informed us that he was diagnosed with hypertension, high cholesterol, and quote unquote, a leaky heart valve. He also quoted, and I quote him, "My doctor told me that if I don't change my lifestyle, I won't be around to see my kids grow up." And that's huge. So in that moment, I know my team, all of us just kind of felt really good knowing that, hey, we could have potentially saved this guy's life. We could have saved him from a heart attack. So to see him come back, we were ready to resume treatment, but we had to speak to his physician. So he cleared all dental treatment as long as no epinephrine was used in the anesthetic, which left us with using carbocaine. Why is the epinephrine component important? Epinephrine tends to raise blood pressure. So if a person's blood pressure is already high, you don't want to use that while you're infiltrating their nerves and their bloodstream with anesthetic. He began his SRP, deep cleaning, and we measure his blood pressure at every single appointment just to make sure he's still healthy. After his scaling and root planing is completed, an amalgam restoration is replaced with composite. So again, these are things that, although the big cases come through and they're so fun to do, this is the bulk of your practice. And practicing dentistry is evaluating the health of people's teeth, their gums, and how those come into play. It's not just the big cases. So this is just a small picture that my hygienist took of his teeth before and after he finished his deep cleaning, going to show that his gums are a lot healthier now. And after she debrided all the calculus, he'll come back in, we'll reevaluate everything. And then on my end, this was tooth number 30. It had an amalgam restoration. You guys could see that it's kind of gray in there. There's little cracks in the tooth, which are allowing bacteria and decay to get underneath. And then we replaced it with a composite filling. So why did I pick this filling and not one that I'm absolutely in love with? I showed you guys one case that I just thought was awesome and I really enjoyed doing and I'm so proud of. And this is one that, although the filling is done well, everything is sealed, the decay is cleaned out. His bite looks good. We didn't do any harm to the tooth. It's one that, in attempt to block out that gray underneath that was showing from the silver, it almost made the filling too white and too opaque. So is it well blended? No. But again, I always tell everyone, challenge yourself, better yourself, and learn not just from those positive successes, but your failures too, because I feel like there's value in them. Not that I would call this a failure. I just think that this is something that I personally could improve on. It makes me question my materials, my polishability, the design, how I carved my resin into the tooth, and just all those things. And it allows me to really better myself, even though it's a back tooth and it won't necessarily show. I think it's important for me as a dentist to see areas that I can improve in. So that's why I picked this case particularly, and for you guys to see the contrast between a big case that made such a big difference and something small but equally important. So that's that. And last but not least, I just wanted to give you guys a little bit of advice, and it's to compete with yourself. Don't worry about what everyone else is doing. People can have the same destination as you, but their path to get there is entirely different. And I say that because I think it's so easy to get bogged down with everyone around you and what they're doing and comparing yourself. But I think the biggest competition is yourself. Don't get in your own way. Just do your best, show up every day for yourself and give the best version of yourself possible. And without a doubt, that will lead you to all the success you need in life. Another person's successes don't reflect your failures and vice versa. So that's pretty much everything I have for my presentation. We're gonna jump into questions, but I did wanna thank everybody for being here, for joining us. Again, I wanna thank the dental shadowers and Claudia and Alexis, because they're about to dive into some questions with me. I really appreciate it, and I hopefully everyone found this beneficial. So we post our Instagram. I think Claudia, if you want to go over that.
Yes. So we do have a few questions. Alexis, would you like to go over them?
Yeah, so the first one is, how does buying a new practice work, and how hard is it to save for one?
So how hard is it to buy a practice? It's not easy, but it's not impossible. It involves a lot of background work. Just first off, finding a practice that you feel is the best fit for you, whether you're buying one that's an existing practice or you're starting one from scratch. You're looking at location, demographics, and then kind of building the team that's going to work with you on the background of it all, which is really important. Your lawyer, because they're signing contracts, you're signing contracts with them and they're reading all the legal terms for you. Your accountant, because they're kind of guiding you through the finances part of it, what you need to do on your end, what the expectations are. And then obviously the financial part is where you save up. The good thing about being a dentist is you are able to, if you work hard enough, you can build a good lifestyle and still be able to kind of tuck away some money. So in the 3 years that for me personally that I knew, okay, in 3 years I plan on buying a practice, I would take a portion of every single paycheck I would get and I would put it to the side, knowing that one day this is what it's going for. And I worked hard, but in no way was I not able to make my ends meet, pay back my student loans, live normally, and do all those things. So I think the biggest thing is just doing the legwork before you jump into buying the practice. Finances aside, you'd want to build a team that's going to look out for you, who's done this before with other people and they can foresee things that you might not necessarily know. So that's where I relied really on my legal team, my accounting team, and all those people, and having a good mentor. I had really, really great dentists that were my faculty members that I am still friends with, who any questions I would have, I would ask them and just be like, what do I do? Is this normal? Is this expected? And they tell you what to look at, what's important, because you don't want to get consumed with the wrong thing that's not really going to lead you to success. So.
Okay, great. So do you recommend for students to be a business major or taking business courses or some kind of certification class outside of college? So that way it'll be easier for them in the future if they do decide to enter private clinics?
I guess I never thought about that, but in hindsight, I don't know how much would apply to dentistry, but knowing that business kind of there's that thread of similarity no matter what kind of business you own, I would say go for it. It's only going to empower you in different ways, and it's only going to serve you as an advantage, not a disadvantage. So if you have the opportunity, do it. Dental school really doesn't teach you a lot about business management. They teach you how to be a dentist. So I think that's a very common struggle that people come out of school with.
So what do you recommend students do during a gap year if they apply and they don't get accepted on their first try?
So there's a couple things you can do. One is to stay active, to show that you weren't just taking a gap year to sit around and kind of do nothing. One, focus on if you're reapplying or you're planning on applying late, and you're taking your DAT, use that time to really focus and improve your score, to do well on that so that you are competitive. Take a few classes. I mean, even if you're done, you finished your degree, you got your degree, you don't need any more requirements. It wouldn't hurt to take a class or two just to kind of show that you're still active as a student. And then shadowing, which is what you guys are all doing now, although in a different form, but just staying active in dental office so that you are getting a different kind of experience that you won't necessarily get out of books, just to show them that you are interested in the dental field and it's not completely new to you. So those are three things that I would recommend, just to kind of buff up your application. and show them that you were proactively working towards your career, even though you weren't necessarily a full-time student.
Thank you. So what would you recommend predental students look for when they apply to schools?
This one's hard to answer because for me, what I personally was looking for was it kind of had to click. Like the dental schools you're going to, it's very rare in the US that the dental schools aren't fully capable of giving you what you need and giving you the clinical knowledge. But I think your priorities have to align with them. So for me, I chose Midwestern because when I met the faculty during my interview and I saw how hands-on everything was and how advanced they were with their technology and it wasn't outdated, that was important to me. I also, knowing their medical school and how successful they were as classes, taking their boards, that was important to me as well. I wanted to make sure I went somewhere that can almost guarantee my success if I put the work in. Things that other people should look at is if you're planning on specializing, does that school have a specialty program? Because it's always nice to have one. I think it gives you a one-up over other programs if you're applying within your program. You want to look at the demographics of the area. Is that somewhere that you plan on being long-term? So those are kind of some things to consider. At the end of the day, if you get into dental school or when you get into dental school, do your best to pick the one that you feel is the best fit for you and just go. A lot will only unfold once you're actually in the program. And no matter what route you take to becoming a dentist, it'll still be a fulfilling one. So.
Is there any training you wish you had more of before graduating?
Before graduating, I felt really good clinically. And I would tell my students when I was a faculty to the dental students is use your time while you're a student to just really immerse yourself in the knowledge there. You have the skills and the experience and the brains of so many dentists around you because that's your faculty. It's people who've done this their whole lives. And I would pick their brains about everything, any case. And I didn't, by no means was I just like, oh, school. I mean, it's hard not to be in that sense, but for me, it was really important to be like, I'm here, I'm not going to leave early. I want to finish this case. I want to go over this treatment plan with, my faculty, just to really like exhaust all efforts, knowing that I was going to be out there on my own one day. So my advice is take advantage of the people that you're around, whether it's if you're shadowing a dental office or a dentist or you are in dental school. Focus your time there and make the most of it. Don't just let time pass and you kind of get by. So I don't know if I necessarily answered the question, but yeah.
Thank you. So what made you choose general dentistry over specializing?
It's the broadness of it, the fact that there's something new every single day. Although not to diminish the other specialties, they have their own array of different procedures. I just like the idea of different ages, different demographics, different procedures, different types of emergencies, different materials, being able to kind of work both towards people's health, towards people's concerns, towards cosmetics, towards everything that fell in between. I think it's just a field that constantly keeps me on my toes. It challenges me, it pushes me. And like I said earlier, no two people are the same, no two teeth are the same. So I could place 100 fillings over the course of a month, for example, and that 101 filling will be completely different than something I've ever seen. So I like that challenge, that it's just constantly something new.
Okay, I think this might be, we still have time. So what do you wish you had known about this field before you entered it?
I don't think there's really anything that I felt was an unpleasant surprise. I mean, besides the surprises that show up day to day. But I want to say I'm really happy with the field I chose. I mean, even in all its challenges, it's worth it. So I guess I would have probably liked to have a better idea of the owner side of everything that is involved in there, because I think dental school does a really good job of explaining to you what to expect. So I think it's just kind of the business side.
What extracurriculars would you recommend for an applicant to stand out?
Anything that interests you. Don't just do something to do it because it gets boring really quick. And I think, if you're going to invest your time, invest something in something that you genuinely enjoy. There's so much out there, whether it's volunteer work or cultural groups or sororities or fraternities. I think just showing that you're a well-balanced student and you're involved in your community, and in things outside of school, with other people, and you can work well with others, says a lot. So anything you're interested in, just go for it.
If you could give any advice to the students who are currently affected by COVID and now are facing a lot of opportunities that are either postponed or canceled, what advice would you give them?
Keep chugging along. Just take it day by day. I know this isn't easy. It's hard to see the light at the end of the tunnel in probably every realm of life right now, whether you're a student or a teacher or a business owner or whatever it is. I think this pandemic has just kind of shaken everyone in many different ways. But I genuinely believe that this is not permanent. So just take it day by day, and remember that time, although it's important, sometimes it creates unnecessary pressure on us. If you're delayed a year, it's okay, because you have your whole life ahead of you to pursue this career and perfect it and make it what you want it to be. So just be patient and it'll be worth it.
Okay, last question. What is your favorite experience, or what was your favorite experience in dental school?
It's kind of similar to my favorite experiences right now, which is just the challenges. Once we were like out of the pre-clinic, and we were seeing actual patients and treating them and just seeing how different everyone is, and being able to take all the knowledge and everything I've gathered over my 4 years of university and then essentially my 4 years of dental school, and being able to apply it and see everything finally click together. All the reasons I took these exams and I wrote those essays and I applied, just to see it finally come together and treat a patient. And even though you're still a student, the respect that they give you for what you're doing, the dedication you have, I think those were my favorite moments, just seeing it click, not just for all the work I did, but even being able to be a provider. I think it was just humbling in the most magnificent way. So.
Okay, I think that should be all for today's session. Thank you so much for joining us, Dr. Salman. We really enjoyed your presentation. And thank you everyone for joining the session.
Thank you, everybody. And if you guys have any questions, feel free to reach out to me.